Hey guys, Esther here,
Hello, this is Tom.
coming to you from Florida Balance Centers and Acupuncture Integrative Medicine. That was a mouthful.
It sure is. Always hard to describe what we do here because we're doing both acupuncture for a variety of conditions, and Florida Balance Centers is therapy, vestibular rehabilitation for chronic inner ear disorders for vertigo, dizziness, and balance problems.
So today, the subject matter is tinnitus. And I'm sure many of us, right? It's a very interesting condition. And both Tom and I have had this condition. And we'd like to share some information with you today that could help you or someone that you know. So let's get into it.
Yes. Should I talk a little bit about tinnitus? So let's give a background about what tinnitus is. You know, typically tinnitus or tinnitus, however you might want to say it, is often the other term for it is ringing in the ears. Now, is it ringing like a telephone, or is it ringing, what does that really mean? Well, there's a variety of sounds, I think, that can be associated with tinnitus. It could be a buzzing sound, a humming sound, a chirping sound, a high-pitched sound. So it can vary from person to person and how they experience that. The bottom line about tinnitus would be a question I would ask is, what causes tinnitus? One of the things we have to rule out when we look at tinnitus is there been any kind of sound trauma. And what we mean by sound trauma, we mean, loud, people being exposed to loud, prolonged loud noises. Some people who work around heavy machinery, construction equipment, the airline industry, musicians, just to name a few, and there's many other places where this can occur. So that would cause physical trauma to the nerves in the cochlea of the inner ear, which is the organ that receives sound.
Would you like to show the model?
Sure, that's a great thing. That's a great segue here. So when we think of the inner ear, right, most people think of the ear and we think of hearing, right? That's the main thing we think of.
You would need a really big earring for this ear, huh?
You would. It's much bigger than I normally, would have. But this is a blown up size of the inner ear. And when we're thinking about the ear and hearing, we're thinking about the auditory canal, the tympanic membrane or the eardrum, the bones of the middle ear, and then that when sound comes in here, it connects to the cochlea. Okay, just to keep it on the simple side. Now the cochlea, if it has trauma from loud exposure to noises, can cause damage, but that doesn't happen in everyone's case. There are many patients we see who don't have noise trauma history, and that comes on suddenly.
So where would that come from?
Right. Now, here's where you have to acknowledge the work of medical medium and his Anthony William, and his description would then describe that primarily the issue there is a low level pathogen, something that's typically hard to detect. Typically viruses is what it appears to be the culprit. Now, these viruses can come in various forms. We won't go into depth here, but primarily it could be Epstein-Barr, it could be shingles viruses, it could be herpetic viruses. There's a variety of things that could get into the inner ear, into the cochlea, and they can burrow there, causing inflammation.
So how do we deal with it?
Well, yeah, so if we have a pathogen that's causing inflammation, then now that's irritating the organ, whether it's the organ itself or the nerve connecting to the organ. Now we have noise sounds, tinnitus, that are chronic and now irritating to the person who's having that symptom. So now treating tinnitus, we do have to be quite frank here, can be one of the more challenging things we deal with. Now, there are patients who we see that get better in several visits or quickly, several weeks to several months. And then there's others that struggle with this for longer periods of time and maybe only have partial improvements or partial recovery. So we have to come up with strategies because this is a difficult and challenging condition like many conditions. And I think this is where, Esther, we could use some emotional intelligence, otherwise known as EI, and help people with their emotional quotient, otherwise known as EQ, and how to get through this process. So maybe you could give us a little, now that we know this, that we have this chronic problem, okay, we can identify it, we can go to work on it, we'll talk a little more about that, but we should also talk about the psychology and the emotional relationship that we might have to have in this process as we go through this. Maybe say something about that.
So that was a very good introduction there with the right acronyms. Good job, Tom. So EI, emotional intelligence, and EQ, emotional quotient. Very good. So basically, we want to start with when we're dealing with a condition, right? So let's take in this moment, we're talking about tinnitus. We want to make friends with our condition. We want to make friends with this condition. And so you may want to say, listen, that's insane. I don't want to make friends with something that's agitating me and driving me crazy every minute of the day. Do you know what that feels like? I do. Because, like I said, I've had this condition, and I also have many other physical ailments like premenopause and all the other things that come with being a female, right? So I completely understand different irritants, not to mention being married, right? But we digress.
Yes.
Anyway, you know we like to keep it light, guys. So you want to make friends with these conditions, okay? In this case, tinnitus. The second step is you want to accept, which is making friends, and then adapt. So acceptance and adapting. Adapting is when now you step into, okay, what do I need to do to now move forward? How do I get help for this situation? And this is when you reach out to a practitioner, to to a doctor, to someone that you trust. They can help you find a way out. And then you take action. And action is one of the most important emotional intelligence tools, EI tools we can have. Because if we don't take action, nothing happens. And quite honestly, a lot of our patients, and that's the situation, is that when we struggle to take the actions we need to take, or we're resisting the information that's coming forth, that is going to delay our recovery. Mm-hmm. And so it's vital that you accept, adapt, and action. You
right.
Take that action.
Let's talk about the action. What kind of action can patients take when it comes to tinnitus? Well, here at Florida Balance Centers and Acupuncture and Integrative Medicine, when we can integrate acupuncture treatments to the ear. We just talked about that there's inflammation there. Acupuncture has been very good and very helpful at helping to minimize or reduce inflammation. How does it do that? Basically, I think acupuncture, a way to describe that is it's moving the blood of the body into these areas, invigorating the organs with new blood, helping to sweep away many of those pathogens. And then we can use tinnitus as a form of biofeedback. What do we mean by biofeedback? We mean that if your tinnitus is flaring up, then you might want to become more aware of your environment and what might be causing it. Try to become, as medical medium says, your own detective. So am I eating foods that might be feeding pathogens? Is my diet really poor with lots of processed chemical foods? Am I creating toxicity in my body and my liver? And now the blood is not really clean, it's kind of dirty. So all these things can lead to increasing the inflammation around the inner ear, or actually, feeding the pathogens so they're becoming more aggressive. So using that as biofeedback has been very helpful for our patients, and they can make changes in their diet and their lifestyle. The other thing is emotional stressors. Like what are our stress levels? Some of that can't be controlled, but we can recognize, right, that if there's a flare-up in tinnitus, then you might recognize that you've been emotionally under some duress, maybe over the last few days, a week, or whatever period of time that caused you to notice that spike. So then you can sort of take actions to diffuse your stress as well. So these are things that we talk about. There's also nutritional things to boost the immune system. Things like taking zinc, lysine, lemon balm. There's a variety of herbal formulas that we can recommend.
And there's also stuff for emotions as well.
Right, the emotional intelligence work you're talking
That's
about.
That's right. The supplements that they can take to help with the emotions.
Right,
Kava.
Calming the nervous system.
Yes, calming the nervous system. So all kinds of supplements that we could take to help calm the nervous system.
Right. So the bottom line here is there is hope.
Yes.
There is hope. Take action, like Esther's mentioning, and get to work on it. Become aware of what are the triggers around you, and let's do as much as we can to help facilitate healing. right? So I think that's the best way to describe this particular condition. It's a little different than our normal discussion about the vestibular system, which is located right next to that cochlea. I'll give you a little quick look at this, but the cochlea is here and your vestibular system is here. So sometimes patients will have problems in both areas. That's not very nice, is it? That's a little bit hard on patients. But again, there's hope with recovery and good information and things that we can take action to do to make ourselves better.
What we know in emotional intelligence and what we know from just overall optimization of healing is that when you start working on one area, the other will also benefit. So everything you start to do, at least in one area, will affect the other.
Very good.
So
with that, we reveal to heal. When we know better, we do better. And what we resist persists.
Absolutely. And when you know and understand yourself, the world will know and understand you too. And remember, what's the best that can happen? Okay, guys.
Bye-bye.
Take care.